Well, it's quite a general talk, more a discussion really with in a meet the expert sort of format. I think the idea is just to try and discuss some of the issues and what are the important things and what are not important. Research is so broad, it's difficult to say this is right and you have to do it in this way. But I think in general, it's keen that when people start research, they have a specific question that is an interesting question and one that is likely to give an answer, and that people approach it in a vaguely scientific way. Too often people start research because they have a machine that measures a certain thing, or they want to look at certain samples, or they want to get their name in a paper, or they want to be invited to a meeting, which is all fine. But I think in general, if you're trying to do research, then you have to start off with a question, and it has to be a question that means something. But what that question is obviously varies hugely, and it depends a bit what you do. But on a day-to-day basis, you see, in sickle cell, for example, there are so many unanswered questions, really. It's not difficult, depending on what you do, if you see a patient and talk to them for 10 minutes, then you can come up with about 10 different questions that we don't know the answer to, all of which are potentially answerable. But the way you answer them can vary from a kind of social type study involving asking questions of patients, or from a very hardcore scientific study where you just analyze samples and heat up tiny bits of water and things. So I think there's a very big spectrum. But I suppose the issue with Voxler recently highlights why it is important to do studies properly, and why you need to ask good questions and present the results honestly, and not just to try and be interested in the truth rather than interested in getting a publication or marketing a drug or selling a product or something like that. So I think the idea is that we're just trying to emphasize that there is a scientific method, and it's good to try and stick to that. And as doctors, certainly, or non-pharmaceutical company employees, I think you have an obligation, well, they have an obligation as well, but you have to try and find out the truth and even if that's not the answer you want, then you still have to present that. In general, I think, the other thing I always think with research, the two things are, one, it's about coping with disappointment, and most things you do don't work and don't work out. And the second thing is, if there are various explanations possible, then the most boring one is always the one that's likely to be correct. And there's a tendency for people to look for interesting, exciting answers, but in general, simple and less interesting things are correct.